Next on Primary Care, the impact of COVID-19 on primary care medicine. It's more serious than you think. Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. Most health professionals understand that the majority of health problems in the Black community occur not because Black people do not take care of themselves, but because access to healthcare resources are woefully inadequate in their neighborhoods. We've said many times on this show that what happens in primary care offices accounts for only about 10 to 20% of a person's health outcomes. The other 80 or 90% comes from what happens outside of the doctor's office. The COVID-19 pandemic is a glaring example of this. Detroit was hit hard by the pandemic because much of the population was already among the city's most vulnerable. Many were essential workers who lived in the same household. This made it difficult for social distancing from one another, given inadequate housing and living conditions. Then there were erroneous myths about this disease circulated throughout the community that left many susceptible to the virus. Finally, a distrust in the health system prevented others from seeking care. As a primary care physician, I've seen a lot in my practice, but I've never seen and experienced the magnitude or the toll of this pandemic has taken on our patients and our community. The half of what has happened has yet to be told. With that said, on today's show, I want to crack the door and look inside this pandemic from a primary care perspective. And to do that, I've invited longtime colleague of mine and a former boss, Chief of Medicine, Dr. Ernie Yoder. Dr. Yoder is the Director of Medical Education at Authority Health, where he is responsible for the education and training of primary care residents in the healthcare setting, as well as, perhaps more importantly, the vulnerable communities that we serve. Dr. Yoder, welcome to Primary Care.
Thank you, Dr. Joe. I'm pleased to be here.
Good. We're so glad to have you, Ernie. Been on our list to get on this show for a while. Dr. Yoder, there's unprecedented times that we live in now, and especially unprecedented times for primary care for providers. We've experienced a tsunami of illness, so to speak, and in looking at this from the lens of primary care, what has been the impact of COVID on the health of the Black communities in Detroit?
I think the COVID has resulted in a decline in the health of the community. As you well know, the Black community is much more vulnerable to the virus as far as severity, death, et cetera, than other populations. And because of issues that we call social determinants of health, the Black community is more vulnerable than, say, the white community to the impact of the virus. And so we've seen patients not able to get to their primary care. Starting in March of 2020, when the COVID started to spread throughout the region, and obviously reluctance for multiple reasons, many of which you already mentioned, of our patients to seek us out and to look to us for advice and care.
You know, we had a hodgepodge of issues, a multifactorial situation in terms of primary care and patient care before COVID. After COVID, it has been almost insurmountable in certain areas, especially in areas or disease states where patients were highly susceptible to the disease. What are the numbers showing across a community like this right now in terms of heart disease, respiratory disease, diabetes, hypertension, those types of things?
So I think you're aware that we're seeing an increment in the presence of COVID, which of course leaves patients vulnerable to other respiratory illness. Patients have not been able to get to their primary care physicians for ongoing, continuous preventive care, and I think that has, as a result, has worsened their overall health. We're seeing patients with asthma, with diabetes, with hypertension, who are less well controlled than they were prior to the pandemic. And it's, as you know, it's a challenge to manage patients when it's difficult, when you're having difficulties seeing them in the practice.
Well, if the system was, fractured before COVID, it's really broken now then, if we've taken a step backwards.
We have, and as you remember, the governor basically put the kibosh on anything that wasn't urgent or emergent services. And so our primary care practices actually took a pause last March, well actually March of 2020. And we used that first week of that pause to reach out to our patients and let them know that we're here and we're available, and to implement telemedicine functions so that we could provide care to our patients.
And I know, Ernie, you and your team over at Authority Health are in the forefront of looking at policy and existing policy and what types of things need to change going forward. Where are we in terms of making some progress in that arena?
I think that's a great question. So the state, I have to say, was largely responsive to our concerns. You probably are aware that the governor mandated the payment for telehealth and telemedicine visits during the COVID pandemic. And we are talking with the health department and the governor about making sure that that continues. The federal government did a similar, although probably temporary thing, but I think the health plans have to be expected to cover any kind of care that patients need when it's provided. And so I'm hopeful that we will treat any methodology for helping to keep people well the same, regardless of whether it's face-to-face or by telemedicine.
That's an excellent point. And as we come out of, or attempt to come out of this COVID pandemic, where does telemedicine fit into this? You know, all these years I've been involved in telemedicine one way or the other, whether it was a phone call or a letter or various modes of communicating. But in today's world of technology, where does telemedicine fit into the practice of primary care?
So I think multiple aspects in the answer to that question. So when in March of 2020 the mandate came down from the state, practices temporarily closed, but very quickly, within a week or two, many of our practices were up and running, providing telemedicine services to our patients. So literally in April of 2020, we were 100% telemedicine. What's happened is that we have continued to see patients by telemedicine, and approximately 20 to 25% of our patient encounters continue to be telemedicine. In addition, we are bringing on board home monitoring devices that link to our electronic health record and to the patient's home devices, computer or smartphones, so that we can provide them the ability to report to us on their condition, and so that we can monitor vital signs, et cetera. I see this as actually a crisis causing an advance in care that could well and should well improve our ability to take care of our patients. One of the major social determinants that we deal with is lack of reliable transportation. And the telemedicine and the remote monitoring capabilities that we've implemented and continue to grow allow us to provide the same level of care that we would provide to patients if they were able to be in the office on a regular basis. So I'm looking for policy to support those efforts. I'm looking for the federal and state government to provide funds to study these methods to make sure that they're as safe as the traditional face-to-face care.
Ernie, the technology is exciting, and I know people are looking forward to the next phase of this. Yeah, I find it interesting that here in the Motor City we have a transportation problem, but more to be told on that story. We need to take a break. We'll be right back with more of Primary Care. Stay tuned.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Find the latest information at getvaccineanswers.org.
Welcome back. We're here with Dr. Ernie Yoder, Director of Medical Education at Authority Health. Ernie, let's not assume that everybody knows what a primary care doctor is. Why don't you expound on that, the definition and the role?
Sure. So I look at primary care in two ways. One is defining it by certain specialties: internal medicine, family medicine, pediatrics, psychiatry, obstetrics, and gynecology. And another is actually looking at the way in which care is provided, and that's the way that I prefer to define primary care. So primary care serves as the access point of people into the healthcare system. And it's not just access, it's guiding, helping people navigate the system, making sure they get the kind of care that they need when they need it in a place that is convenient for them. And primary care provides continuous or continuity of care, comprehensive care. And it is really critical that a major component of that be preventive care. So the focus is not just on disease management or disease treatment, although that's a very important part of primary care, but it's on wellness, helping all people that come to the practice to achieve their optimal level of wellness and health and to maintain that wellness and health as long as possible.
So coming out of this pandemic, are we going to be damaged to the degree that primary care suffers with such a great charge?
So I hope not. Obviously, we've got a significant shortage of physicians across the board in the United States. It is projected by the year 2025 that we will have a shortage of more than 25,000 primary care physicians in the United States. The Teaching Health Center program that's funded from the U.S. Congress via HRSA is seeking to address that, in particular focusing on vulnerable populations. So that program looks at two things. One is establishing additional rural and federally qualified health centers in areas of physician need or primary care need. And then the other is training the physicians in those environments. And our goal in this program is to create a pipeline of future physicians and other healthcare workers from those communities through college, through professional school, and then training in our residencies and having them stay in those communities to provide great care for all Americans.
That's interesting because we know now from various studies, numerous studies, that the people who are most likely to return to areas of need are the ones who grew up there, the ones who made a commitment there. It's almost like the educational system. Somebody's got to go to the elementary school that's in the worst neighborhood to teach the kids because they're there. It becomes a location problem. And the answer is to have people who commit to the location as well to the need of healthcare. And that seems to be what we have been missing, but it also is something that I know that you at Authority Health have been addressing. You seem to be picking the right type of people ahead of time to have these discussions with. I've seen lots of the trainees from Authority Health, and we're just very impressed with the attitudes and the perspective that they have on the practice of medicine. You guys seem to have a leg up on this as opposed to some of the traditional ways of selecting residents and trainees that we've dealt with for many, many years.
So we use a holistic process, and we have set goals for ourselves. We would like our whole staff, including physicians and other healthcare workers and administrative folks, to be reflective of the communities that we serve. And that helps us to attract candidates into the residency programs that also are a fit, if you will, for that. It's really critical to us that patients in our communities have the ability to choose a physician and the team that they will trust. And many times it's a physician that looks a lot like them. And so those are our guiding principles. And we've made statements about disparities and about diversity. And we live those, and those are component to our mission and vision for Authority Health.
You know, if we're ever going to get over this mistrust of the healthcare system, these type of issues have to be addressed. They have to be addressed in terms of goals and timetables and outcomes, which actually mean producing the individuals that serve in this capacity. And that's basically what we see happening over at Authority Health. Let's shift gears for just a second here. We have a lot of myths circulating in the community at large, and specifically in certain ethnic communities about vaccinations. What kind of problems have you run up against in terms of people receiving vaccinations for COVID in the clinical setting?
So many patients and families come to us to talk about the possibility of receiving the vaccine, and they've heard or read many falsehoods about the vaccines. And so what we've tried to do is create understandable literature and plans for how we will teach folks about the vaccines to help reassure them. What's really critical to this is developing the trusting relationship. And so the existence of primary care practices like our Popoff Family Health Center within the city are really important to the neighborhoods, so that folks can easily access the practice, they can receive the health care that they need and want on a regular basis, build the relationship with the physician-led team so that the physician-patient relationship develops a high level of trust. And those patients that have been with our practices for the longest period of time are almost uniformly vaccinated. The other folks that have not had a good relationship with healthcare, who have not had the opportunity to develop a fully trusting relationship, less likely to be vaccinated. We have a lot of work to do to help the members of our community understand the vaccine, that it is in fact a safe thing to do, and it's the best way to protect themselves from the adverse effects of COVID-19.
Ernie, tell us about what's on the horizon, the number of trainees that you have in the program, plans for future expansion.
So right now we have 71 residents in training in the 4 specialties that I mentioned: family medicine, internal medicine, pediatrics, and psychiatry. We just received a notice of funding opportunity from HRSA to do 2 things: to potentially add more programs, but perhaps more importantly, to expand the currently existing programs. So we'll work with our accrediting body and with HRSA to submit the requests and the data that they need to see so that we can actually grow the programs. And as I mentioned before, our programs training is largely in the community. It's within the federally qualified health centers here in the city and near the city. And those partners who have been wonderful to work with will help us to expand the availability of physicians as residents, and then hopefully we will continue to retain physicians to the community.
Very good. Dr. Yoder, we're up against another break. Stay with us. We'll be right back.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Find the latest information at getvaccineanswers.org.
Our dear fellow Americans, vaccines are a huge step forward. We still need to do the simple things that we know work.
Wear a mask, wash our hands frequently, and maintain social distance.
Now it's up to you.
Welcome back. We're here with Dr. Ernie Yoder, Director of Medical Education at Authority Health. Dr. Yoder, you touched earlier on this landscape of providers and the shortage that we're up against in the future in terms of physicians. Help us understand some of the particulars about that, because we know, just from a historical perspective, that populations usually respond better to people that they can identify with. We see that in every ethnic group that's on the planet. But we seem to be missing the boat in terms of how we get those type of providers into those type of communities. And we know that that's one of the things over at Authority Health that you guys are focusing on and trying to help meet some of these needs. We had a discussion here earlier, just a little sidebar discussion about how we only see real progress in the treatment of depression in African American males if they are speaking to a African American male provider. That's where we get the most bang for the buck. That as an example as to why we need to pay attention to these nuances on who's doing what to who.
So the system has been biased. It's been biased for the 47 years that I've been in medicine since the time I started medical school. And it's biased, quite frankly, in favor of white males. One of the things that we've seen occur over the 47 years that I've been engaged in medicine is that the gender field has leveled. And there actually are more women in medicine now than men, at least in the training pipeline.
That's true.
So that's progress. However, the underrepresented minority component has not been effectively addressed. About 10 years or so ago, it was recognized that the number of black males in medical school had dropped to an all-time low. We've clawed our way back to approximately the same level that we were at prior to that nadir, but the numbers of underrepresented minorities in medical school are inadequate. I think that you lay the blame or the cause at the base of communities and school systems and universities and colleges. And we have to level the playing field there and make sure that representatives, members of those communities have this access to the same level of education and can make the same choices for career that Caucasians can make. And until we address that, I think we're going to continue to deal with this maldistribution of positions in the healthcare system, in medical schools, et cetera, as well as the maldistribution of providers of care in our communities.
You know, Ernie, some of those numbers went all the way back to 1902, 1903 in terms of the percentages that we have fallen back to. It really points out that we are not addressing this at certain levels properly, like the interview process for medical school, or how we have pipeline programs that actually can engage students and shepherd them through things like programs that can help them not be afraid of math and science, or absolutely get them into some hands-on situations with things called mentors, or programs that can actually step up the game in terms of what they're exposed to and create that interest in healthcare early on instead of waiting till we have to choose people and look outside the door and there's nobody there.
Yeah, I couldn't agree more. I think it's really critical that we have role models in all of these communities. And as you and I discussed earlier, the areas that tend to be the most underserved are core cities and rural areas. And those are the pipelines that need to be developed. And in order to develop those pipelines, we need good role models, we need intentional changes in the educational system, and we need to make sure that the resources are present so that the students have the opportunity to achieve.
Yeah, you know, some of the statistics in rural areas look exactly like some of the statistics that we see in inner cities.
Isn't it fascinating that the social
Absolutely.
determinants that result in disparities in healthcare in the rural and the inner city areas are virtually identical?
That's amazing, especially since we are at the point where maybe if we can tease out some of these things as we assess the situation and look at the statistics, if we could actually tease out some of these things to get to the point to say, listen, there's no real difference in the medical side of these diseases from population to population, but these other social determinants of health is what we need to address in order to make a difference and get the outcomes that we want.
Absolutely. We need to make sure people have the ability to get to their care site. We need to make sure that we deal with poverty, which is one of the largest causal agents in ill health and in disparities and so on. We need to make sure that the built environment is supportive of community, that folks have access to support, and that we address toxic environments, et cetera. All this has to be dealt with.
So we have to have a discussion sooner or later in this country about race, racism, microaggression, cultural competency. We have to address all those issues as we attempt to solve the solution. Now, my premise has been for a long time that if we can solve the inequities in healthcare, we can solve a lot of the inequities in society. I think that healthcare lends us to a point, especially looking at things that COVID has exposed in terms of the inadequacies of the healthcare system. It brings us to a point where if we can actually say, listen, this is what's fair for all the boats to be raised, we can apply that same kind of approach to some of the other so-called social determinants of healthcare, or social determinants period, not just healthcare. We can apply that across the board in this country and begin to see how we actually make progress in these areas.
Amen. I'm hoping that healthcare can be the model, if you will, for how we can address these sorts of issues. So at Authority Health last year, we did a needs assessment and partnered with New Detroit to develop a program for our trainees. And by the way, we're including all of our staff and leadership in this program, but to help them understand the different ethnic groups, the conditions that they have existed in, how they've struggled to get health care, the kinds of biases that exist in the system and so on, so that our trainees become the doctors that are comfortable having these challenging conversations, and they learn to listen. You know, one of my mentors said, you know, we have 2 ears and 1 mouth, and that means we should listen twice as much as we talk. And so those are some of the principles that we are trying to teach and model for our future physicians.
Ernie, thank you so much for being our guest today. And just on a personal note, thank you for all of the leadership you've provided over the years in this community, and in particularly the outstanding job that you guys are doing under your leadership over at Medical Education and at Authority Health. We really appreciate that, and we look forward to having this discussion again and talking about all the success that has been achieved in the future. Thank you so much.
Thank you, Lonnie, and I'm honored to be here.
Good, my pleasure. Our guest has been Dr. Ernie Yoder, Director of Medical Education at Authority Health. We know that access to quality, affordable primary care is linked to better preventative care, better chronic disease management, higher patient satisfaction, and lower costs. It's the foundation of healthcare, and it's worth fighting for. We have to step up to the challenge and begin to fight. For Primary Care, I'm Dr. Lonnie Joe. Thank you for watching.